Member for her reminiscences from last century. It's so nice to hear about what she was doing when she was Minister of Health last century. So she spent all this money when there was more money than the government knew what to do with, and she never did a thing for Dunedin Hospital. All she and her cronies ever did for 9 years was mine the asset, replace nothing, do no maintenance, run the facilities down. It was so bad that in her last year as Minister of Health, she was berating her own Labor appointees for running deficits of over $8–9 million for years on end. So when the money was raining out of the sky, how much money did Annette King give to Dunedin Hospital to fix their buildings? Nothing. She just mined the asset and did nothing. But wait for it, wait for it. The budget went up, and did they get money for buildings? No. But look at her record on operations for the people of the South. In her first year as Minister of Health, 8,800 people got elective surgery. 8,800. When she left office, 8,400 had got elective surgery. So fewer people got elective surgery when she finished being Minister of Health than when she started being Minister of Health. So when Annette King left as Minister of Health, 8,400 operations done that year at Dunedin Hospital. This last year under review, 10,270 elective operations. She left with 8,400. Today, 10,270 in the 12-13. She had 6 years and fewer people got operations. I've had 6 years and we've increased it massively from when she was Minister of Health. We've put an extra $124 million in there, 82 more doctors, 116 more nurses, and an emergency department that Dunedin can be proud of. Because it's not people lying around the corridors unsafe for hours and hours and hours, which I inherited. Oh, the neonatal unit, shameful. Neonatal unit, shameful. This was for the most vulnerable babies born at Dunedin Hospital, stuck into the smallest footprint you could possibly find. It was not a good service. 9 years of Labor government, nothing happened, and we put the money in, and our Prime Minister was there opening a state-of-the-art neonatal intensive care unit at Dunedin Public Hospital, an investment by this government when the money was tight. When the money was tight, we found the money to put in a new neonatal intensive care unit. And I have to say, I get fantastic feedback from Dunedin for the investment that our government's made in that NICU. I get amazing feedback from Dunedin on the massive improvements at the emergency department. People in Dunedin now know. I'll tell you about the colonoscopies. Under Labor, people who's had a family history of colonoscopy were denied the ability to go and have a surveillance colonoscopy. Labor stopped surveillance colonoscopy at Dunedin. National has started it again. Labor stopped surveillance colonoscopy. We've started it. So we've started at Dunedin. So that's the truth of that member's failure. And I'm not going to harp on about last century, because it's so different from when that member came in 1984. The Dunedin Hospital is a much better place. The services are improving. More patients getting elective surgery. Remember, between 1999 and 2005, fewer patients got elective surgery. Fewer patients got elective surgery. And now, under our government, record numbers of patients are getting elective surgery at Dunedin Public Hospital. The emergency department's working better. The cancer services are fantastic and working faster. And we're getting more preventive care for the children of the Otago Southland region. So right across the board, this District Health Board is delivering on service, and this government is giving them the money and the staff to improve care for people in Dunedin. Yeah.
Point of order, the Honourable Annie King.
I wish to table an official information request on the number of leaks at Dunedin Hospital. The Minister said there'd been one.
Leave aside for that purpose. Is there any objection? There is no objection. That can be tabled. The question is that the report... Order. I'm putting a vote. The question is that the report of the Health Committee on the 2012-13 financial review of the Southern District Health Board be noted. Those of that opinion will say aye. To the contrary, no. The ayes have it. Members, I understand the next entity members wish to debate is the New Zealand Teachers' Council, and the question is that the report of the Education and Science Committee on the 2012-13 financial review of the New Zealand Teachers' Council